Hi, I'm Dr. Sarah Lai, and I'm a specialist in pediatric dentistry.
Dr. Lai, which topic are we discussing today?
We're going to be talking about dental anxiety with children when they come to the pediatric dental clinic. In the dental clinic, we see a lot of children of various ages, from as young as babies, a few months old, to teenagers, and they have a spectrum of different types of behaviors. The youngest child could be very well-behaved, and you could also have an older child who is particularly fearful of seeing the dentist.
What are the techniques that we may use to alleviate the anxiety and fear?
Very often, we use the tell, show, do technique that involves showing the child what the dental operatory is about, showing them all the different equipment we have, the different instruments we have, and demonstrating how they are used in the mouth. We will also try to have a conversation with the child and to give them some mental preparation on how the dental visit will go prior to the dental examination. Also, we encourage parents to talk to the patient before the dental visit and to perhaps read them a book about dental visit or show them a video about a visit to the dentist so that the child could have some mental preparation before they come in person. On top of that, we also have some distraction techniques, which could involve a television. So we might be able to play some cartoons for the child during treatment, or we could play some music. On top of that, we try to speak to the child during dental treatment so that the child could feel more comfortable while having treatment done. We also have a lot of positive reinforcement. We have a lot of rewards, such as toys and stickers for the child if they behave well during the treatment. We also try to gradually expose the child little by little to more complex procedures one at a time. Because of that, treating a child might take longer than treating an adult because we might start with simpler procedures first before moving on to more complex procedures. Dental anxiety is very common in children because there is the fear of the unknown. Very often, they have not seen a dentist before. They are also scared of different environment. They're also scared of strangers. And therefore, having everything put together and coming to the clinic where they are in an unfamiliar environment would definitely cause some distress and anxiety. Sometimes the child might have been experiencing pain for a duration of time at home already, and coming to see the dentist would cause them to be even more anxious because they think that the procedure will be extremely painful. It would be advisable to bring your child to see the dentist before the child is experiencing pain.
How would parents be able to potentially help navigating the fear?
Prior to the dental visit, I would advise parents to talk to the patient about what it is like to visit the dentist. One useful way would be to read a book to the child about a dentist visit. Another way would also be to show a video about dentist visit, and this can be commonly found in YouTube. We would also recommend that parents try to avoid certain terms such as pain or hurt. For example, there would be no need to say, "Don't worry, it will not be painful. Don't worry, it will not hurt," because that would just make the child think about pain and think about it hurting even more. Rather than doing that, it might be good to just encourage and try to be positive prior to the dental visit and as well as during the dental visit. Of course, there are certain procedures that might be particularly more distressing, such as administering local anesthesia in children. Often, I would tell the parents first not mention the word needle or injection because that will make the child very fearful. We have technique to make the child as comfortable as possible, and one would be to apply topical local anesthesia to numb the area before we give the injection. And we also try to conceal the needle so that the child doesn't see the needle as we are administering it. I would just advise the parent to speak with the dentist so that we can come up with a plan to make the child as comfortable as possible during the procedure. Hope the sharing today is useful, and thank you for listening.